I'd like to describe CPPA's background and then get into the mission and vision about the organization. I think the background is very important to that mission and vision. CPPA was started by 3 national pharmacy organizations, and those are the National Association of Boards of Pharmacy, the American Pharmacists Association, and the American Society of Health System Pharmacists. This organization, CPPA, is a 501c6, but the owners operate in a partnership manner in managing CPPA. Now, these 3 organizations came together over a common belief that patient care will be improved through the development and widespread use of voluntary accreditation standards that help ensure quality through the entire medication use process. And this really speaks to the mission of the Center for Pharmacy Practice Accreditation, and that is to use accreditation as a tool to help advance pharmacy practice, to push it forward, and subsequently improve patient outcomes. These 3 organizations also came together for 2 other purposes. The first one being that they felt strongly that the pharmacy profession itself should set standards for the delivery of pharmacy care, and also that there should be one accrediting organization within the profession. Now, the vision for pharmacy practice, as previously mentioned, really is to develop standards and accreditation programs across the medication use continuum. And we'll do this in 2 manners, through the standards, which will facilitate high-quality, safe and effective dispensing and patient care services, and the use of patient care data to advance that care, but also through the accreditation process itself. The process should compel change and innovation as well as recognition for those pharmacy practices. Well, I'm really happy to report that CPPA actually started discussing issues of importance to the National Hemophilia Foundation during the development of the specialty pharmacy practice standards, and then continued that conversation throughout the vetting process of the standards. Our goal was, and we achieved it, we believe, the development of consensus-based specialty pharmacy standards. We consider NHF and other patient advocacy groups as very important stakeholders for specialty pharmacy practice accreditation. And we want to continue the discussion with NHF in order to inform their public and others about the value of CPPA accreditation, but we also want to continue to learn from NHF about their advocacy needs and how we can continue over time to align our standards. There definitely are practice quality standards directly related to hemophilia management in our specialty pharmacy standards. So this would be an example. If a practice provides hemophilia-related medications and or products, that practice must have a scope of service describing what they will be providing via patient care and products, etc. They also need to ensure that there's appropriate professional and support staff to provide those services. And another example is the inclusion of an emergency plan if any of those services or products are interrupted for some reason that the practice has been unable to control. The other area that I think the standards relate directly to hemophilia management is in our appendices. We actually include an appendices which specifies the elements of care required at initiation and required with each refill for bleeding disorders. A few of those requirements are a prescription order turnaround in less than 48 hours, supplied dose within 5 to 10% of ordered dose, lot number tracking, and assessment of bleeding and dispensing history for that patient. We also include in this appendices best practices, and this is where NHF has really assisted us in the development of the standards. So we've set the bar for delivery of patient care services around bleeding disorders. CPPA's specialty pharmacy accreditation process is quite straightforward. It starts with an application, and we review the applicant for licensures in good standing, not only for the practice, but for their pharmacists and any other staff that have required licensures. Then we assign an accreditation staff member to work with that applicant all the way through the accreditation process. This staff member can help answer questions and guide them through the process. The next step is the review or submission of policy and procedures and written evidence of compliance with the standards by the applicant. And we provide a document assessment tool for them to use to make that part of the process very smooth and easy. Once the accreditation staff member has reviewed that documentation and feels that the applicant is ready for survey, we actually conduct a site survey. Following the survey, we prepare a report and provide that to the applicant. That report lists their best practices that we found. It lists consultative recommendations, ideas that we have for helping them improve their practice, and it includes a list of any non-compliant standards. For those non-compliant standards, the applicant has 30 days to provide us with an action plan on how they will come into compliance with the standards. Once we've reviewed that plan and found it acceptable, we move that practice to accreditation decision. Well, payers have begun to require specialty pharmacy practice accreditation in order for a specialty pharmacy practice to be part of their network. So the evolution of accreditation has really started with payer demand. In recent surveys, however, of the payers, and these are over the last 2 to 3 years, one of their biggest concerns that they cite repeatedly is the need for specialty practices to have patient care services which can really help patients make the best use of their medication. So we believe that specialty pharmacies who employ the CPPA standards for patient care and all our other standards can be really recognized by the payers for excellent care in all their areas of service, but hemophilia included if that's part of their scope of care. I'd like to start with an answer to this question with how CPPA defines specialty pharmacy practice, because I think it's very illustrative of the question and the answer. We define specialty pharmacy practice as the management of the medication access and handling requirements of the specialty medications, and secondly, as the provision of clinical management services for patients receiving specialty medications aimed toward achieving desired patient therapeutic and economic outcomes. So how do the standards lend themselves to that? How do specialty pharmacies lend themselves to this delivery of care that gets patients to cost-effective patient therapeutic outcomes? Well, that's through the assessment and monitoring of patients at therapy initiation, such as determining the appropriateness of the medication, determining the appropriateness of the patient for that medication, determining and reviewing dose, and then at refill and throughout treatment, reassessing that appropriateness, evaluating any adverse drug events that the patient may be experiencing, side effects, etc., and their compliance with the medication. So these are just some examples of how specialty pharmacies can improve and provide high-quality care and improve the quality of life for the patients through the services that they provide. Specialty pharmacy has a huge role in integrated health care. Of all the medications that we have to treat patients, the specialty medications are used to treat patients often requiring intensive care. So specialty pharmacies really need to have input and communication with members of the healthcare team, and they need to document those interactions. So pharmacists and specialty pharmacy teams are talking not only to the patients, but they have to be talking to the healthcare providers at the time of medication therapy initiation and in an ongoing manner. Now, CPPA's accreditation programs were really designed and planned to accommodate evolving models of specialty pharmacy care in integrated health networks such as ACOs and primary care medical homes. So, for example, in academic medical centers, health systems, and some specialty pharmacy where care is being delivered at multiple areas, places, we often see, for example, the pharmacist providing direct patient care in the clinic setting. They might be in outpatient pharmacy, and they might be on the phone. So a specialty pharmacy needs to have a model that can accommodate examples such as these that fit into IHNs, ACOs, and the PCMHs. Employing standards of care through an accreditation process, I believe, is a major tool in driving quality and a high standard of care. So whatever those barriers were, standards can really help move and advance that care. So let me provide a couple examples. Requirements for pharmacy-delivered patient case management and the use of patient care protocols, which include evidence-based guidelines, are key to high quality. Also, the requirement for an ongoing quality improvement program where operations, patient care services, and associated measures are tracked and trended. These are critical, but most importantly, it's looking and evaluating the pharmacy practice on the evidence they provide of the positive changes they've made as a result of tracking and trending their care. And you do that around measures. So these are ways I think measures and standards can be used through accreditation and drive improved quality of care.